When we talk about the relationship between vertebrae, we should take into consideration not only the osseous components, but of course the joints, ligamentous components, and neurovascular structures that are involved in these relationships. Uh, so from this posterior view of the cervical region and upper thoracic region, we can visualize two of the three joint complex. Um, in the complex that we're seeing here are the facet joints, one for each side, which are formed by this inferior articular process and the superior articular process of the adjacent vertebra. These joints are covered by a 1 to 2 millimeter thick layer of hyaline cartilage. The biomechanical function of each pair of facet joints is to guide and limit the motion between vertebrae. A little bit of anatomy in this area from cephalic to caudal. We see the occipital condyle, the atlanto-occipital articulation or joint, the posterior arch of C1, the third segment of the vertebral artery, and this is an anatomical variation in which there's a osseous bridge covering the third segment, and that's called a ponticulus posticus. We see inferiorly the paravertebral venous plexus and the ligamentum flavum, which is gonna be present and attaching from lamina to lamina in this vertebrae. We see the bifid process of C2 as well as the long spinous process of C7 and T1. Now this is a lateral view of the cervical region, and again what we're seeing right here is the zygapophyseal joint or facet joint from the articulation of this inferior articular process and the superior articular process. What we're seeing also right here is the transverse process with two tubercles, meaning that we're drawing out at a subaxial level. There's an anterior and inferior tubercle, and there's an intertubercular lamella that is going to be connecting these two tubercles. There's a nerve that is going to be resting over the spinal nerve groove, and there are going to be two rami. One is a ventral, and the other is a dorsal rami. And again, this is part of the axial and subaxial region of the spine. This is a posterior view of the lumbar spine, and again what we're seeing here is the zygapophyseal articulations. We're gonna go over the different variations in the morphology and the features that make every region unique, but we can see clearly the inferior articular process and the superior articular process of the adjacent lumbar vertebra. Anterior to the lamina, we see the intervertebral foramen, and we also see the supraspinal ligament, which is going to be attached to the spinous processes. Anterior to the transverse process, we see the quadratum lumborum, and as we mentioned, from this side, there's an intervertebral foramen. What we're seeing here is the exit of a spinal nerve. Now, the intervertebral disc is an important component for the interbody joint. There are 32 intervertebral discs, which account for 1/3 of the spine's height. They help to hold the vertebrae together and provide stability and absorb the shock. The components of each disc, which are the nucleus pulposus and annulus fibrosus, and also the superior and inferior cartilaginous end plates, have different compositions of proteoglycan, collagen, and water. Essentially, the nucleus pulposus, which is at the center, resists and redistributes pressure from the spinal column. the annulus fibrosus, which is at the periphery, is stiffer and tougher. It's composed of collagenous lamellae that are arranged around the nucleus pulposus, like the plies of a tire. The outermost layer of the annulus fibrosus fuses with the periosteum of the vertebral body. So remember, the vertebral body is going to be just inferior and superior to the disc. And these bodies are going to be covered anteriorly by the anterior longitudinal ligament and posteriorly by the posterior longitudinal ligaments. And these are going to be connective tissues that are going to be fused with the annulus fibrosus at their respective sites. So we can identify that this is lumbar region, a lower lumbar region. The reason is because we can see the cauda equina nerves in the spinal canal. We see this short and broad lamina and the Z joint that we mentioned previously. We also see the abdominal aorta and inferior vena cava. Now this is a lateral view again of the lumbar region, and this gives us a very nice perspective of different joints, what we call the three complex joint. Again, a facet joint and an interbody joint forming what resembles a tripod. We also see an intervertebral foramen that is going to have a roof and it's going to have a floor made of the notches of the pedicles. We remember there's an inferior notch and a superior notch. Usually in this lumbar region, the inferior notch is going to be more prominent. Now, there's a number of structures passing through the intervertebral foramen, and that includes from spinal nerves, the different segmental arteries, in recurrent meningeal arteries and nerves, lymphatic tissue, and also there are going to be some transforaminal ligaments that might play an important role for the obstruction or compression of a nerve root. If we move anteriorly, we have the vertebral body that, as we mentioned in the previous slide, anteriorly is covered by the anterior longitudinal ligament, and posteriorly is going to be covered by the posterior longitudinal ligament. The annulus fibrosus, which is located at the periphery of the disc, is going to fuse anteriorly with the anterior longitudinal ligament and posteriorly with the posterior longitudinal ligament. And at the center, the nucleus pulposus. So what we're seeing here is an interlateral view of the subaxial region. This is the axis right here is going to be the atlas. And again, we see fit the third segment of the vertebral artery and the second segment of the vertebral artery. So there's a unique feature of the subaxial spine, which is this with an process which is lateral projection of the superior surface, and this uncinate process articulate with the reciprocal convex area on the inferolateral aspect of the upper body. Functionally, this oncovertebral joint, which is the articulation again, limits the lateral displacement of the intervertebral disc. And a little bit of anatomy. We've seen the pedicle, the inferior notch, the superior notch, the groove for the spinal nerve, the pedicle of C4, and the intervertebral foramen. Let's move to the next slide. And so this is a cross section of the upper lumbar thoracic region, and what we're seeing here is, or we can identify right here, is the spinal canal. The spinal canal is the collection of the vertebral foramina. It is enclosed by the vertebral bodies anteriorly and the disc, and also the posterior longitudinal ligament, and posteriorly by the laminae and the ligamentum flava, laterally by the facet joints and also the pedicles. The spinal canal is an osseous and fibrous passage that contains the spinal cord, the nerve roots, and inferiorly at the level of L1 or below L1, L2, the cauda equina. There's also CSF, and there are gonna be membranes, as pretty much like in the brain, covering the spinal cord. There are gonna be the pia, the arachnoid, and the dura, which is the outermost layer. There's also there's gonna be venous plexus, and mainly in the lumbosacral region, there's gonna be a high content of adipose tissue that is gonna be filling the epidural space. Um, Next. So what we're seeing here is a posterior view of the left side, the lumbar region. And what we can identify right here is the supraspinal ligament, the interspinal ligament, and in between the lamina, we can see the ligamentum flavum from the left side. We see the spinal nerve emerging from the intervertebral foramen. We see a plexus, a pain plexus, and we can see also a segmental artery, a transverse process, and around this area, surrounding or being part of the intervertebral foramen, laterally, we see the transforaminal ligament. There are usually a number of transforaminal ligaments. It's not a single ligament. We see right here is a posterior view of the cervical region. This is C2, so this is C3 after a laminectomy on the right side. This is the bifid process of C2, and we can visualize the location or the relationship of the dural sleeve covering the nerve roots, the pedicle and inferior and superior notches of this case C4 and C3, and how anterior to the nerve root we can find the second segment of the vertebral artery. We see the ligamentum flavum, which again is attached to the inferior superior edge, to the superior edge of the inferior lamina, and it's going to be attached to the inner portion of the inferior edge of the superior lamina. Now this is an anterior view of the craniocervical region, and we can identify a couple of big vascular structures. We see the right and left vertebral arteries, and these are going to be the occipital condyles. Again, this is an anterior view cross-section from a coronal plane, and this is the atlanto-occipital articulation. And what we see here is the anterior spinal artery, which is a branch formed by both vertebral arteries. We see the dural sleeve of the C2 nerve, and we're seeing over the condyle the hypoglossal nerve. So this is the hypoglossal canal. Superiorly, we see the jugular foramen with its neural content and vascular content. We also see the denticulate ligament that is gonna serve as an attachment. It's gonna emerge from the pia and it's going to attach to the lateral portion of the spinal canal, and it's going to help to stabilize the spinal cord. Now this is a posterior view. Again, the craniocervical junction, in this case the cervical medullary transition or region, and what we're seeing here is the posterior part of the posterior spinal artery and also the posterior spinal nerve. The posterior spinal arteries appear in pairs compared to the anterior spinal artery, and they also come from the vertebral artery conventionally. Sometimes they emerge from the posterior inferior cerebellar artery, and they descend along the posterolateral spinal cord and are reinforced by several posterior segmental medullary arteries along the way. So a little bit of anatomy that we see here is the posterior arch of C1 after removing part of it. We see the 11th nerve, we see the occipital condyle, and we see the mastoid, both mastoid tips, the cerebellum, transverse sinus, sigmoid sinus, and the transition between this vertical segment of V3 to a horizontal segment of V3.